Welcome to the Cold Steel Surgical Podcast with your hosts Amir Farouk and Chad Ball.
Dr. Andrea Merrill is a surgical oncologist in Charlottesville, Virginia. She's the creator of Scrub Delta, a website dedicated to highlighting the talents and passions of surgeons and trainees outside of the operating room. As listeners to the Cold Steel Podcast will know, Chad and I have been obsessed with exploring how to be the best surgeons we can be without losing our humanity in the process. Dr. Merrill has some really important insights on how we might walk that line between being completely immersed in surgery, but also staying grounded. We also talked with her about several of her superb pieces of writing, including Free Solo and Taylor Swift in the Operating Room. We'd love to hear from you. What hobbies or side hustles do you have? How do you balance them with a life in surgery? Email us at podcast.cjs@gmail.com. Dr. Merrill, thank you very much for joining us today on the Cold Steel Podcast. It's a pleasure and an honor to have you on the show. Can you start by telling us a little bit about where you grew up and where you did your training?
Yes, and thank you so much for having me on. Looking at your guest list that you've had on, I'm very honored to be here. So I grew up in the western part of Massachusetts, and then I was in Boston for a very long time with college, undergraduate, my residency at Mass General Hospital. I left briefly to do fellowship at Ohio State in surgical oncology, and then went back to Boston for my first job. And now I'm currently in Charlottesville, Virginia.
Fantastic. So what drew you to surgical oncology?
Well, so what initially drew me to medicine was actually orthopedic surgery because I got injured a lot. And so I was like gung-ho, ortho, actually had all my stuff ready to apply my fourth year of med school. And then they forced us to do a sub-I that was not ortho, and I did surgical oncology. And I absolutely loved it. I just kind of loved being able to operate all over the body, being able to work with multiple disciplines. The patients really are truly amazing and inspiring. And I started to think that I was going to maybe miss out on some of the medical parts of my training by doing orthopedic surgery. And so I kind of switched last minute to surgical oncology, and I'm very grateful that I did.
And Andrea, what's your practice like currently now?
So my training and fellowship was very broad in complex general surgical oncology. So I did kind of the full breadth of it there. My first job, I did a combination of breast surgery and endocrine surgery. But as breast cancer has become much more complicated, there are new studies that come out like every day. I've sort of narrowed down to just focusing on breast surgery.
Focus is probably helpful in all of our careers. Better to be an inch wide and a mile deep, as they say. So that sounds great. You're such a multi-talented person with so much going on. I'm curious, number one, at 30,000 feet, how you manage your days and your weeks. And then secondarily, tell us about how you evolved into such a beautiful photographer and writer.
Thank you. I feel fully honored by those compliments. Well, I will say my life now is definitely a lot easier than it was as a resident, but I'm very type A and organized and make a lot of lists. So it's probably how I managed to do multiple things and stay organized. I also think that in medicine, our days are so stressful, you kind of need something else to balance it out, or else you're not really fully available mentally for your patients. So I think it's really important to have other things outside of medicine that keep you busy and that you enjoy doing. Photography was something I actually did in high school. I took a photography course using like a real camera. We developed the film ourselves, doing black and white photos. That sort of fell to the back as I pursued, schooling, medical school. And then when I was a resident, I really liked to bake, and I started a baking blog. And so I decided in my research time, since I had more free time, I would pick up photography again. So I took some classes in digital photography. And so I did that for my blog, and then also for some local restaurants at the time. I don't do it really as much now. Most of the pictures I actually take are on my iPhone, because the iPhone actually is pretty good, has a pretty good camera. But I think it's a nice way to kind of see the world around you, where you can sort of edit the photo to share your vision of what you're seeing. And then the writing, I think, probably came from a love of reading. I think in order to be a good writer, you have to read. I've always enjoyed reading, storytelling. And I think one of the things I really liked about medicine was meeting the patients and learning their stories. I really believe that every patient has their own story. All of us providers, doctors have our own stories. And I think it's important to share those because it really humanizes us and it helps us connect better with our patients. And so I sort of dabbled in writing a little bit in residency. I wrote a piece for the Huffington Post about being a woman surgeon, but then I really started to get into it when I became an attending and took some classes.
We've had a chance to read some of your stuff and look at some of your pictures, and they're really, really quite beautiful. And certainly for the blog, like there's some really lovely photos that you have there from yourself and from other people. So it's really beautiful to see. And we can see some lovely pictures in the background there too. Like I'm intrigued by the one that says Descent. I assume that one is Ruth Bader Ginsburg. Well, like for anyone who's listening to this, the audio only, you have some like really fantastic pictures. Like you'd get like a 10 out of 10 for your Zoom background for sure.
Thanks. My home office. So I can't really take credit for any of those pictures because I didn't personally do them. They were created mostly by residents or students. Some of them were gifted to me. One of them was actually created by a nurse at where I was before. And I love art. I think the intersection of medicine and art is very cool because you're taking something that's kind of scary, but turning it into something beautiful. I collect a lot of art. So my office at work and my office at home has tons of art all over.
You know, it's interesting that you bring up the intersection between art and medicine or surgery and creativity. I've shared this before on the podcast, but, you know, I have some training and background in speech arts and grew up very involved in performing prose and poetry and things like that. And I remember during my interviews for residency for general surgery, one residency location, which will go unnamed, someone said, "Oh, well, are you sure you're really suited for surgery? Like you have all this sort of artistic background, or, you know, are you sure you wouldn't enjoy doing internal medicine?" Like maybe they thought I was Abraham Verghese or something. But, you know, I'm curious what your thoughts are. Like, how do you see that, the tension? Because in one sense, surgery is not really artistic in the sense that people always tell you, like, you don't want an operation named after you in your first few years. You don't want to invent operations that have never been described before. You know, you're not creating something from new, but I would certainly argue myself that there is an artistry and a creativity in terms of how you problem solve in the operating room. But I'm curious your take, like, how do you balance those facets of yourself, the creativity, the artistry, and the cold, hard steel science of being in the operating room?
Yeah, that is a great question. And that experience you shared is actually what inspired me to start Scrubbed Out Surgery, the website. I had a few trainees that I mentor who, you know, were very active in the arts and have had some really amazing accomplishments outside of medicine, but they felt like they kind of had to hide those because they were worried that it would be looked down upon by other people in surgery. I think that those should be celebrated. I think embracing our artistic side or our creative side is very important. Again, it makes us humans. You know, all of us could be a patient one day. We should treat them as if we were, you know, treating ourselves or a family member. There are many situations that really require us to be creative and sort of think outside the box. And I think the more that you are creative outside of medicine, the more you might be able to think about that and understand your patients. So I think they kind of go hand in hand. And I feel like a lot of surgeons I know are creative and are very talented either in art or photography, music. But I think it really only adds to your appreciation of life and of what we get to do every day.
For me, it reminds me of like the real value of, and the mission behind what we do in many ways, right? Like it's the tumor in this person that is part of humanity. And, you know, like it's important to kind of remind myself about, you know, why I'm doing what I'm doing. And so I resonate a lot with what you're saying.
Yeah. Along those lines, I always tell my patients, we are treating you, not just your cancer.
Yeah. And it's surprisingly easy to lose sight of that sometimes. So I think that's so important. And we really want to delve a little bit more into the website because that's really something that really intrigued us. But before we do that, I couldn't help but want to pick your brain about the piece that you wrote for Annals of Surgery called Free Solo. Especially as a new attending myself, I really resonated a lot with the things that you talked about in that piece. Can you, for our listeners, and I would encourage everyone who's listening to this to go and read it for themselves, but can you talk a little bit about your piece called Free Solo?
So I wrote that probably about a year and a half into being an attending surgeon, and published it in JAMA Surgery called Free Solo Surgery. And I sort of had the idea for it when I was in fellowship, and I had this like really challenging case that I mostly did myself. The attending was like doing scopes, and I mostly did it. It was a case we had to do, like there was no other choice, but I really had pushed the attending. I felt like I really owned the decision making, and the patient had, I think, inevitable but unfortunate complications after. And I like really felt that in my soul. And I was like, oh, wow, I'm going to have to be responsible for this sort of thing for the rest of my career. And it like that really sank in then. And so I actually wrote a piece then kind of about that transition and responsibility and sort of anticipating becoming an attending. I sent it into the New England Journal of Medicine and they rejected it. They rejected everything I've written. They're very hard to get into. They have a very high bar, but they're like, I think you're maybe a little too vulnerable in this piece. I don't know if you want people like knowing all this stuff. And so I was like, okay, I need to figure out another way to talk about this. So I kind of let it sit for a while. And then I became an attending. So then I like really felt it. And so I had some ideas. And actually my boyfriend was the one who mentioned the Free Solo documentary. And so we were talking about it completely unrelated to surgery. And then I started thinking about how it was similar and that it's something that people can sort of identify with. Anyone can sort of imagine themselves on the side of a cliff without anything to hold them on and let that fear. So I figured it was kind of a nice vessel, an analogy for me to tell my own story. And to write that one, I did actually sign up for a writing class at Boston University. They had a narrative writing course that was for not just doctors, but other professors at BU. And so that was, I think, a 9-month writing course where we met once a month. And so kind of paragraph by paragraph, I wrote that through the course. And again, it was a little bit scary to write it because putting that stuff out there about your anxiety is a little bit scary, whether or not, other people might judge you, whether patients might read it and think, oh, I don't want to see the surgeon knowing she had these thoughts. But I thought it was really important to put out there in the world because I think a lot of us do have this anxiety as we go through the beginning of our, being an attending. But I didn't feel like many people talked about it. And I was like, am I the only one not getting it? And so I think that's, the power in sharing these stories that we make other people feel less alone by knowing other people have similar experiences.
What has the reaction been like? Has anyone, colleagues or patients actually read it and then shared their thoughts with you about it?
I would say for that one, all the reactions have been positive. Mostly the reactions were like on social media and some colleagues in person. I didn't have anyone reach out with any negative comments, and I haven't had any patients really comment. Maybe a few had read it and commented, but most of the comments were positive. So I think I was able to sort of achieve a balance of being honest and vulnerable, but maybe not too vulnerable.
Yeah, I mean, I resonated with that a lot. I think it is very true that all of a sudden when you're in the driving seat, it is, the same operation that you've done a million times suddenly becomes a very different proposition. So yeah, it is like scaling without any ropes, right? And the stakes are very high. But like as you say, the fact that you shared it, I think there's a lot to demystify and sort of open the doors for people to have conversations. And I think we've had other people on the show that have done this in various ways, like, Haitham Kafarani having that surgeon as a second victim. Like at the end of it, we're human beings and we all feel like this, and acknowledging that I don't think should make us seem weaker. It definitely takes some bravery to put that out there and acknowledge it, right? One of the other pieces that we really enjoyed was this piece that you wrote about Taylor Swift and how, like the choice in music for you really wasn't just a preference or an idiosyncrasy. Like this was something that really meant a lot to you to be able to play Taylor Swift. Can you talk a little bit about why Taylor Swift wasn't just a random music choice for you?
Yes. I mean, well, I am kind of obsessed with her. I have like 10 scrub hats that have Taylor Swift themes on them. And so I do love her music, but it does go a little bit beyond that for me. I think her earlier music was more like romantic, kind of like a younger teenager. But I think as she has grown up, she's matured and her writing and her songs have matured a lot. And I think, there's probably some similarities to her being this like powerful artist who's a billionaire and crushing it and always being in the spotlight, and female surgeons having to sort of like fight their way to be taken seriously. And so, I think a lot of people think her songs are just about her boyfriends and breakups, but a lot of her songs are actually about kind of being in the spotlight, not being taken seriously. She has another one called The Man that talks about how if she were a man, she'd probably get a lot farther and faster than if she were a woman. And so I really identified with that. And I find that her music is actually empowering and uplifting, especially for women. And so for me, I really like to be surrounded by that when I'm in the OR. It also sort of calms me down a little bit. The OR sometimes can be a little bit chaotic and things you can't always control. And so like the music is the one thing I know I have and can control. And so it's sort of like my grounding point in the operating room.
That's so fantastic. And it's funny how little I think most of the rest of us put into playing music. So you've really changed the way that Amir and I think about it. So thank you for that.
I do probably annoy a lot of people because not everyone likes her. I do try not to play only Taylor Swift, but there's definitely
Right.
a lot of Taylor Swift. Yeah.
Oh, that's great. One of the other amazing things you've done, and we do really mean amazing, is your website Scrubbed Out. And I'm curious, we're both curious, how that came about. What was the impetus or the driver, the trigger for you to do that? And how do you see that as a contribution to our general surgical kind of community and beyond? Because I really think it is a significant contribution. It's a unique endeavor, both in tone and content. What are your thoughts, and what was the genesis of it?
So, as we were talking about earlier, and Amir kind of shared that experience where they're like, oh, you like art stuff and, maybe you want to do internal medicine. I think, a lot of people in surgery sometimes or there may be a perception that they may look down on some of these artistic endeavors. I mentor a lot of residents and students, and I've had a few who are very into art, some of them doing art within the medical space, but they always thought that like their art was less than someone else's, basic science research or outcomes research. Well, I thought their art was amazing and made them very unique as a person and gave them very unique skills to be a surgeon and, see the body in different ways and also connect with patients. And so I was like, well, maybe if we had a website celebrating this and people could see all the other people in surgery that have cool, creativity, maybe that would be more accepted and people would feel a little bit better about it. So I started it for that reason. And so I invited a bunch of people I knew. And I keep the submissions open. Like I accept anyone in surgery, students, residents, attendings, international students. I've had a bunch of international submissions. So I've gotten to sort of meet people from all the world. Dr. Jeffrey Matthews, who's a chair at University of Chicago, was also on there. So that was pretty cool because like when I've had the opportunity to connect with him. He's a musician. You can find his music on the website and on Spotify. And so it was just this cool way, I think, to showcase that, surgeons are human, to show it's acceptable to show that human side. I like to share that part with patients also. It helps me connect with them. I think it helps build trust. And so I think it's something that we should really celebrate.
One of the tensions that I find, again, that we're all struggling with a little bit, and sometimes this comes out as a generational thing. People are always talking about Gen Zs or millennials and blah, 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 all this stuff. But there is this tension, again, about how how do we become totally masters of our craft and go all in to become the best surgeons that we can be, and the master technicians, the master decision makers, really at the top of our craft, but also not losing ourselves. And I could see people looking at your website and saying, well, how do these people have the time to pursue these other things? I mean, nobody can say to Jeff Matthews, how do you have the time? I mean, he has all the credentials that one could possibly think of, right? But for the trainee or the medical student who is still pursuing their passions, you could certainly see there a scenario where their attendings are saying, well, you're not spending enough time reading Sabistons or whatever the case is. I'm curious how you think about that tension and how, how you go about navigating that both for yourself and also for the people that you've highlighted on the website.
I mean, I do think the culture in surgery has shifted a lot. The culture in medicine has shifted a lot. I feel like people used to kind of look at it as a calling, and your life was as a surgeon, and it was like unheard of to do other things really outside of surgery. But I think that was to the detriment of ourselves and our patients. I think if that is your life and the only thing you really live for, like you're going to burn out really quickly. And then you're not serving yourself or your patients. I think you need some sort of outlet. Obviously, you need a balance, and you can't, allow those things to interfere. But I think as long as someone is, performing well as a resident, performing well as a student or an attending, and is not interfering with it, I think it's something that we should embrace. And again, I think it makes us better humans to connect better. And, I do think for some of the things that some people like kind of find a parallel between their creative hobby or passion and surgery, and it may actually make them better. Like some people who like knit with the hand-eye coordination, I think some of the art, it kind of helps them to remember the anatomy and to see it in a different way. Like spatially, I think they probably have a little bit of a different mind that probably makes them a better surgeon in that way. So I do think that they can be comparable. They don't necessarily have to be like fighting with each other.
Yeah, like synergistic as opposed to antagonistic. On the flip side, let me put it to you the inverse. I think one of the things that, as we were so aware of, the discussion around physician burnout, which is such a big issue. I think one of the things that is sort of almost a cliche now is that people will tell you, well, make sure that you have time, make time for your own passions, make sure that you make time for yourself to do things you enjoy. And then it almost becomes like another item on your to-do list. Like, oh man, if I haven't picked up the paintbrush or read a book in 6 months, then somehow I'm like losing myself. And there's like this feeling that like, oh man, what's going on? And this feeling of despair. What's your sort of thought process around that for the people who have these passions that they may have pursued to a lesser or higher extent before starting their careers in medicine? What's sort of your advice to those people, having had all these other people on your website?
Yeah, I mean, I feel like maybe the pendulum has swung a little bit the other way, but I think if something that you enjoy becomes a checklist, then it's probably not something you enjoy anymore. And sometimes what you want to do may change over time. Like I'll admit, I haven't been writing for a little while because I have a little bit of writer's block. And so I've just been enjoying other things like getting into garden. I do think it's important to make time for other things. It may not be that every single day you have balance. There are some days where you need to stay at work later, your patients need you, or even some weeks where things are crazier. You have a conference, you come back, you operate, you're there late, but then maybe the next week you find time for something else. And I know there's a lot of programs looking into, maybe we should start like a narrative writing program or like an art program. And I think those are great, but it kind of gets to what you're talking about, like forcing someone to do something. I think we all have different things that draw us in. And so I think people need to find something specific to them. So it doesn't have to be art or writing or reading. Maybe they really like to, mountain bike or weightlift, just some outlet outside of medicine that's helpful. For some people, it's spending time with family, going to a place of worship. So lots of things that people can do. And again, it's more about like work-life equilibrium, or not necessarily balance, because you're not going to have it every day, but just, sort of a push-pull.
Yeah, one of our guests in the past, Rebecca Auer, say work-life harmony. And I think that's a good.
That's a good way of looking at it.
Obviously this is like trying to choose your favorite book or favorite Taylor Swift song, but what were some of your favorite people or talents that you've highlighted on the website?
So one of my favorites is a resident that I mentor. She is a general surgery resident at Beth Israel. Her name's Stephanie Cohen. She also runs marathons. She's very talented in many ways, but she does really amazing art with anatomy. Some of it's very like clever, sort of like a pun. And then she's also doing some medical illustration. And she's also done some research with art as well, like art and surgery, art for patient education. So her stuff is very, very cool. There's actually another resident at Beth Israel. They're a lot of talented surgery residents who has written and photographed for 2 Chinese cookbooks. And her most recent cookbook was just nominated for a James Beard Award. Her name's Betty Liu. She's, I think, a 4th year resident now. And somehow she wrote a best-selling cookbook and photographed it, like pretty amazing. So those are some of my favorite. I think, again, Jeff Matthews, that was pretty cool to have on there because, how often do you have a chair on there? I did just highlight a resident from UC San Diego, Sophie Chong. She had done some research at Boston Medical Center, so that's how I knew her. But she does like aerial art, so kind of like art in the air. She also is a violinist and a writer. She didn't highlight all the things, but she does a lot of things.
Well, there's some very, very talented people out there. And that's what you realize reading your blog. Well, listen, Andrea, thank you so much for coming on the show. It's always great to have these types of discussions. And I think you've done such an amazing job of trying to like take the lid off a little bit of this aura or this persona that sometimes we as surgeons like to put on as invulnerable and, like just some sort of robot. The Elon Musk thinks that can replace us, right, with robots in the next 5 years. And really, the work that you've done shows us that there's so much more to the work that we do than being technicians in the operating room. So thank you for that. One of the questions we ask all of our guests on the show is if you could go back in time to give yourself advice as a chief resident, knowing what you know now, what advice would you give yourself?
Yeah, that is hard. I don't know if it would be advice, but I would just kind of tell myself that things might change. I wouldn't have expected me to be like in Virginia doing, just focusing on breast surgery in a non-academic practice. And so I think I maybe would have told myself to relax a little, not stress as much. Things are going to happen. I don't need to figure out the rest of my life at that moment because it's going to change probably a million times. I usually ask medical students, what do you want to do when you grow up? And they're like, I don't know. And I go, I don't know either. So I feel like, you don't have to have everything figured out, but as a chief, you kind of feel that way. Okay, I'm going to go to fellowship and I'm going to get a job here and I'm going to do this research. I'm going to do that. And so I think I would tell myself to kind of relax, let things happen, be open to new experiences, explore different types of practices, and that things will somehow work out.
You've been listening to Cold Steel, the official podcast of the Canadian Journal of Surgery. If you have comments or questions, please email us at podcast.cjs@gmail.com. Thanks for listening.